with us this morning. I think there's a few people filtering in, so make yourselves comfortable. My name's Matt Skinner. I'm the Chief Exec at Care City and recently appointed Director of the BD Collective. So hopefully this morning is going to be quite an informative workshop to kind of give you an understanding of what this is all about. So I'm not going to kind of get into the detail yet. I'll hand over to colleagues to do that in a bit. But I guess just some context setting, I guess, that might be helpful. As I'm sure a lot of you know, the government has set out an ambition for a reformed health system, which they're calling neighbourhood health. And that focuses on early kind of proactive action with the community and residents and the VCFSE playing a really strong role in the model and in health creation. And excitingly for all of us, Barking Dagenham was selected as one of the first pioneer places to kind of develop that model. And so today is a bit of an information session to hopefully explain what some of that means, but it's also really a call to action. There's no perfect solution to kind of neighbourhood health. There's no model that everybody's trying to copy. And we don't have all the answers today because of that. But what we do have is an opportunity to start to design the model that's right for our place together, that builds on a lot of, hopefully, the strengths of what works, but also learns from some of the things that we know maybe haven't worked in the past. So today about information, but there's also some really specific things that we need to help explain. And it's also to give you some space, hopefully, to kind of put yourself in the future and to really imagine what this could look like in our place when we've succeeded in hopefully a few months time. So Care City, I guess today our role is to help play a bit of a convening and facilitation role around what this kind of health network creation bit looks like. There's a lot of stuff going on nationally around the kind of pioneer program for neighbourhood health that lots of people are kind of involved in. There's loads of forums, lots of governance, lots of kind of learning from other places. And as part of the kind of national program, our place has been asked to kind of put forward somebody to be a local lead to help with that facilitation, to kind of go to forums, to be part of that national program. And it's all happening at a really rapid pace. So in discussion with the BD Collective, we've appointed Elspeth in that kind of role to help lead locally and facilitate some of this work. And so I'm going to hand over to her in a second, just to start talking us through, I guess, what some of this means and hopefully to start getting into some of the design with you all today. Just really importantly, because I know it will be a question, organisations that are taking part locally will be compensated for their time. And in terms of some of the roles and the things that we might describe today, please know that we're working through that with the local authority at the moment, but be assured that people will be compensated for that time. So that's definitely coming. Great. So I think that's all from me, unless you think I've missed anything else, but I'm going to hand over to you to start getting into some of the content. And hopefully everybody has a bit of fun today as well. Yeah, looking forward to it.
Thanks, Matt. And yeah, fun is really key as we're designing things together. So thank you for landing on that point. So Matt's done a really good job of kind of painting a bit of a national context, the West Streeting policy of getting health out of hospital, inappropriate health out of hospitals and into the community. There's a real emphasis on prevention and co-creation. And there's the 3 shifts, which many of you will have heard talk about. So it's that out of hospital into the community, and there's some local examples of that. These aren't exclusive, these are just ones that are in my mind. There's the Connect work, there's the neighbourhood networks work, there's the work on the river roading, there's other examples as well, but just to give you a bit of a flavour, hopefully you will know at least one of those pieces of work. Then there's from treating sickness to preventing it, which is kind of the more negative way round of saying health creation. And much of that is around building healthy communities where informal support is recognised as being as important as clinical, and taking that real asset-based approach. The second thing is third thing is from taking it from analogue to digital, which is, there's lots of paper-based, older, clunkier systems into more modern, interoperable kind of systems that enhance care rather than getting in the way, and support the well-being of both patients and, importantly, clinicians too. But the bit that we're really focusing on is that second bit, that how do we create health? How do we prevent ill health in the first place? So there's a bit of a structural overhaul as well. Health services are close to a desire for health services to be closer to home, working out what needs to be at scale, like the hospitals need to be happen at scale, and what's better delivered more locally, but also really importantly for us, holistically, and focusing on a real relational approach. And that's across the system. That's not just us in the room, across the system. How do we move from a really transactional, siloed way of working into a much more relational way of working, where we pick up the phone to one another, we work things out together, we work with people as well. Sorry, Amelie, I should have got you to move the slides on. Could you move on to the third slide, please? So it's the what that I'm on, so maybe go back one. So the BD Collective, along the way, across the last 6 years, we've been testing how we can build connections, how we can develop trust, how we can be accountable across the sector, and how we can collaborate together and recognise who is best placed to develop the different strands of work. It's that thing of we win together, and as we win together, our individual organisations will also win. We will develop as we all develop together, and also build relationships with the other sectors. Matt talked about the National Neighbourhoods Health Implementation Programme. That's a little bit of a mouthful, so it's been shortened to NNHIP. So if you hear someone say NNHIP, that's what it is. We're one of they're calling a vanguard place. We put an application in common with everybody else across the country, and we were one of the 43 selected. When we asked why we were selected, the answer was because of your work in the community, the innovative work in the community. So we're kind of in quite a good place in that sense. You think about Connect, the GP pop-ups as well, the original neighbourhood network work, which was via the localities at the time. We've learnt loads over the past few years. They all served us to win this bid. When I say we, I mean the partnership across all of the sectors. There is no money from central government, but our local authority is putting some money into the pot. But there is a significance here in the drive from the public sector to develop this way of working, this relational way of working, and that's quite different. Changing that transactional way of working into relational. So as I say, the council have made some funding available to enable the collective to lead the community sector work and develop that place-based culture. The resident, the stated ambition is that we become, across the partnership of all sectors, resident-led, with people at the centre, proactive person-centred care that improves the health and well-being of residents in neighbourhoods, led by the needs and ambitions of residents, co-producing solutions, and a culture of inclusivity that addresses the bias and some of the systemic inequalities, and to build on existing collaboration and integration, testing ideas, learning iteratively and adapting accordingly. Now, we are a very long way away from that across, as cross-sector, but we have a real opportunity to start practicing some of that way of working. And as Matt said, there's going to be 4 health networks, and they will be mapped to the geography of the public sector, quite deliberately to enable that cross-sector working. I'll come on to that geography in a bit. Next slide, please, Amelie. So how? Well, as I said, we're going to test, we're going to lead, we're going to learn. We're working at place, and the way I think it's best to describe is as an innovation partnership together. It's not just a network of disparate organisations doing their own thing. It's a real partnership. How do we work together? How do we innovate together? How do we work with people? that development of a kind of a one team approach, you might call it, and being really values driven, gathered around a question that we might think about together, explore together, is quite disruptive to the way that we've been working up until now. Then we'll take an ethnographic approach to working with our communities. So we're coming away from consulting and surveying, not saying that those things are bad at all, but developing a much more immersive sort of approach. Creating a culture where residents and council and system partners can participate on a more equal footing. Shifting about talking about lived experience to doing something together in real life. Building relationships and shared understanding before deep conversations about priorities or solutions. So really developing that relational approach. Making visible the everyday constraints that residents manage. That might be time or energy, money, care, work, community. It could be lots of different things. But at the same time, really emphasising and surfacing the parts of residents' lives that are supported by and contributed to by those community, those relationships, those informal networks and systems that public sector can't and shouldn't ever try to turn into services or try to do. So it's more about the way of working, our posture, our understanding, and it's not about fixing or deciding what should be done right quite yet. That will come. So out of this, as I say, we'll start to shape the solutions and develop our place-based muscle is kind of how I've thought about it. Working with the wide variety of people that are in a neighbourhood, and that might be local leaders, it might be residents, it might be public sector. It could, you know, it could be us in the room in a relational way. And it sounds less like my organisation should be funded to expand our X programme and more like, how do we work together? How do we fan the flame of this that's happening in our neighbourhood? Or how do we work together to tackle that that's happening or isn't present in the neighbourhood? So it includes everyone's expertise. It requires everyone to sort of contribute what they have, recognises all the factors and the actors that are involved. Next slide, please, Emily. And then finally, we are going to be in these 4 health networks, health focus networks, and they'll be mapped to the, missed the word of that, mapped to the geography of these public sector places, working in a really asset-based way with people, building on the strengths that are there, and cross-sector and involving residents as well. So if you go to the next slide, please, Emily. You can see there the geography that the public sector have landed on. So we've got the 4 neighbourhoods that, confusingly, they are called neighbourhoods, not to be confused with neighbourhood networks, which is a voluntary sector asset-based community development kind of approach. These are much bigger footprints, but north, south, east and west, very plain and simple. The neighbourhood networks that I mentioned obviously are working at a hyper-local level, spaces where residents can identify the things they want to change with funding attached, and they enable that testing and learning to happen. But the health networks are these larger footprints. We have to find a way to make sure those 2 things come together, that the neighbourhood networks are absolutely involved in the work of the health networks so that they don't get siloed, and that work with residents isn't siloed, because that's so important. It's so critical. And this, as I say, just circling back to where I started, it's a real opportunity to bring the attributes of everything together, opportunity to practice those BD collectives values really deeply. If you go on to the next slide, please, Emily. You know, we're a values-driven movement. We want to discover how we really build trust? How do we develop trust together? How do we build that connection? How do we be accountable for how we're working together and with our public sector colleagues? And how do we really share it, kind of bring that equality of sharing the power, that we recognise actually you're best placed to do this at this point in time, I'm best placed to do something else, and vice versa. So really practicing that power sharing. So next slide. Today we are going to really immerse ourselves, and I want us to be quite playful. I want us to imagine. So we've got our what do you call those things? AI. I've forgotten the name of them. Anyway, those kind of mask things VR. On. VR. Thank you. Virtual reality. That's the one I'm looking for. We've got our VR masks on, and we're immersing ourselves in a neighbourhood, and we're imagining. And just for the moment, just set the funding issue aside because it'll trip us up. But you're part of one of these networks. You've noticed your community is a really friendly one. You can see, I've imagined my own neighbourhood here as I've written this. I know that the dog walkers all say hello to one another in the park. I know that some of the local shopkeepers really know what's going on in the neighbourhood, and they often chat to their customers. Sometimes they'll point them in the direction of something. I know that parents and children really enjoy gathering in a community space just down the road, and I know that when I walk in there, there's lots of fun and laughter going on, and there's lots of friendships. I know that some of the neighbours pop in on each other. But I also know that there's a number of people who don't feel safe in the community. They feel quite isolated. I know some people suffer with anxiety and depression, and there's a number who would have multiple physical issues going on as well. So we're wanting to find ways of working alongside people together as a place to create that better physical and mental health, and really build on the assets that we've got there. I've just described some of them. You'll have others in your mind of your neighbourhood you can imagine. So next slide. How can we work together? We want to build relationship as equals. We trust each other. We want to test and learn things together and with the other sectors. That might be GPs, it might be somebody from adult social care, it might be your social prescriber, it might be other voluntary sector organisations, it might be the knit and natter group down the road, it might be the resident, a whole range of people. How do you involve them? The ones who live in your neighbourhood, the people who live in your neighbourhood. And what can happen now that couldn't happen before? That's our overarching question that we're asking today. If we start to work in this way, what can happen that couldn't happen before? So I'm going to pop you into, well, I'm not, Amelie is going to pop you into some breakout rooms in a moment, and you'll have a good half an hour to think about this question that we're posing ourselves. Have a think about what's hard, what's important, have a think about who else might be involved. Think about what are we learning, who are we learning it from, which will be different on different occasions, of course. And how are we building trust with one another and with who else? All right. So Amelie's going to pop those